Stop. Before you sit in that dental chair and commit to a procedure that could cost thousands of dollars and change your facial structure forever, there are things your dentist might not be telling you. Most people think a dental implant is just a simple replacement for a missing tooth, but the truth is much more complex. Choosing the wrong type of implant or ignoring specific health risks can lead to implant failure, bone loss, or even nerve damage. In this video, we are breaking down everything you must know before getting dental implants, from single tooth replacements to full mouth reconstructions like All-on-4 and All-on-6. This is the ultimate guide to saving your smile and your money. A dental implant is not just a prosthetic tooth, it is a sophisticated medical device designed to replace the root of a tooth. Made typically from medical-grade titanium or zirconia, the implant is surgically placed into the jawbone. Over time, a biological process called osseointegration occurs, where your bone actually grows into and fuses with the metal. This creates a foundation as strong as, or sometimes stronger than, a natural tooth root. When we talk about dental implants, we are looking at three specific parts: the implant post itself, the abutment, which acts as a connector, and the final prosthetic crown or bridge that looks like a tooth. Understanding these components is vital because the quality of each part determines the longevity of your restoration. Not all implants are created equal. Depending on your bone density and oral health, your surgeon will choose between different types. First, we have endosteel implants. These are the most common. They are shaped like small screws and are placed directly into the jawbone. They are the gold standard for most patients with healthy bone structure. Second, there are subperiosteal implants. These are used for patients who do not have enough natural jawbone and cannot or do not want to undergo a bone graft. Instead of going into the bone, these sit on top of the bone but under the gum tissue. Finally, for more complex cases involving the upper jaw where significant bone loss has occurred, there are zygomatic implants. These are longer than traditional implants and are anchored into the cheekbone or the zygoma instead of the jaw. This is a highly specialized procedure that requires an expert oral surgeon. If you are missing just one tooth, a single dental implant is the most effective solution. It prevents the neighboring teeth from shifting, and more importantly, it prevents the jawbone from deteriorating. Unlike a dental bridge, an implant does not require the grinding down of healthy adjacent teeth. However, if you are missing several teeth in a row, you might not need an implant for every single gap. An implant-supported bridge can replace 3 or 4 teeth using only 2 implants as anchors. This is a cost-effective way to restore function without the need for multiple surgeries. Now let's talk about full arch restoration. If you are edentulous, meaning you have lost all your teeth, or if your remaining teeth are failing due to periodontal disease, you have likely heard of All-on-4 or All-on-6. The All-on-X concept is revolutionary. Instead of replacing every tooth with an individual implant, which would be surgically traumatic and incredibly expensive, a full arch of teeth is supported by just 4 or 6 strategically placed implants. All-on-4 is often chosen for patients with lower bone density in the back of the mouth. The 2 posterior implants are placed at an angle to maximize contact with the existing bone. This often eliminates the need for expensive and time-consuming bone grafting. All-on-6, on the other hand, provides extra stability. By using 6 implants, the biting pressure is distributed more evenly across the jaw. This is often recommended for patients with a stronger bite or those who have sufficient bone volume to support the extra anchors. Both systems provide a fixed, non-removable set of teeth that look, feel, and function like natural teeth. Before we dive into the risks and the essential checklist you need for your consultation, I want to take a second to ask you a favor. If you are finding this breakdown helpful, please subscribe to our channel and hit the notification bell. We create these deep dives to help you make informed decisions about your health. Also, I want to hear from you. Have you had an implant consultation yet? Or maybe you have a story about your dental journey. Leave a comment below sharing your experience. Your story might help someone else who is feeling nervous about the procedure. And if you know someone considering dental work, send this video to them. Now, let's get back to the critical details. Every surgery carries risks, and dental implant placement is no exception. It is important to be realistic. While dental implants have a success rate of over 95%, failures do happen. The most common complication is peri-implantitis. This is an inflammatory condition that affects the soft and hard tissues around the implant. Much like gum disease, it is caused by bacteria and can lead to bone loss and implant failure if not treated immediately. There is also the risk of nerve damage, which can cause numbness or tingling in your natural teeth, lips, or chin. In the upper jaw, there is a risk of the implant protruding into the sinus cavity, which is why a sinus lift procedure is sometimes necessary before the implant is placed. Smoking and uncontrolled diabetes are the two biggest enemies of dental implants. They significantly slow down the healing process and interfere with osseointegration. If you are a smoker, your risk of implant failure is significantly higher than that of a non-smoker. If you are ready to move forward, the most important thing is the diagnostic phase. Do not settle for a dentist who only takes a standard 2D X-ray. For successful implant placement, a 3D cone beam CT scan is essential. This allows the dentist to see the exact thickness of your bone, the location of nerves, and the position of your sinuses. You should also ask about the material of the crown. Is it zirconia? Is it porcelain fused to metal? The material affects both the aesthetics and the durability of your new smile. Furthermore, ask about the guided surgery option. This is where the dentist uses a computer-generated template to place the implants with sub-millimeter precision. It reduces surgery time, minimizes swelling, and ensures the best possible placement for long-term success. Once the surgery is over and your permanent teeth are in place, the work isn't finished. You must treat your implants with more care than natural teeth. While an implant cannot get a cavity, the tissues holding it in place can still get infected. Professional cleanings every 6 months are non-negotiable. Your dental hygienist will use special instruments designed not to scratch the titanium surface. At home, you should use a soft bristle toothbrush, non-abrasive toothpaste, and water flossers to keep the area around the abutment pristine. Dental implants are a life-changing investment. They restore your ability to eat, speak, and smile with confidence. But success depends on your health, the skill of your surgeon, and your commitment to aftercare. Don't rush into the cheapest option. Look for experience, technology, and a clear treatment plan. Armed with this knowledge, you can walk into your dental consultation not as a confused patient, but as an informed advocate for your own oral health. Your smile is worth the effort to get it right the first time.